So what do these three skin conditions have in common? Well, the answer is that they're all caused by yeast infections. So the first one is known as tinea versicolor, and this is caused by a yeast or a mold infection known as Bacillus furfur, and it can cause white patches or pale patches on the skin, and they can really then join together to cause bigger patches, and this is found either on the trunk of your body, the abdomen, or also the back. So this condition is harmless, totally harmless, but what's interesting about it, it doesn't actually tan, so you get to see it a little bit more when you're tanned, and you may not have noticed it when you haven't got any sun exposure. The second skin condition is known as ringworm, and no, there are no rings, there are no worms in this condition. It's literally a fungal skin condition, and it can cause itchy skin, and it's characterized by sort of a circle that it tends to be red, it tends to be scaly, and also maybe silvery in color. So this is your typical ringworm skin infection. The third one is actually fungal acne. Now, fungal acne is caused by a yeast infection. It's known as Malassezia folliculitis, and it's infection of the hair follicles that cause red, itchy, white bumps on your skin. Now, when it comes to fungal acne, it's really important to distinguish between fungal acne and comedonal acne, and they are totally different. And so their characteristics are totally different. The way they feel they're totally different, and how they're treated is also so different. Now, fungal skin infections are typically treated with antifungal preparations. So you have here shampoos as well as creams. So shampoos such as ketoconazole can be treating skin infections. And yes, I know it's a shampoo, but can be used to treat skin conditions by applying it for a designated period of time and then washing it off. Clostromazole cream, on the other hand, can be used twice a day. It's really an effective treatment for ringworm, for example. However, when it comes to comedonal acne, that's a completely different ballgame. So what you've got here is products such as azelaic acid, which is fantastic in treatment of acne. You have retinoids, antibiotics such as Zineret, or sometimes you can get retinoids that are combined with antibiotics, as an example. Paul has chosen you a really good one, which is actually azelaic acid with salicylic acid to treat acne, and you also have benzoyl peroxide. These are the topical treatments, and there are also oral preparations that can be used to manage acne, as well as in clinics treatments too. So if you want to know more about it, about different skin conditions, please get in touch on dermafine.com or message me on my social media channels. But it's really, really important that you make sure that your skin specialist or your dermatologist really diagnose the skin condition and give you the right treatment for it. Take care, guys. Stay amazing.